It is sometimes hard to separate facts from fiction when it comes to coronavirus and the pandemic. This morning, our 9 health expert, Dr. Payal Kohli, is joining us once again to give us some facts. Dr. Kohli, good morning.
Good morning, Gary.
So here's the deal. I'm going to mention some things that have been going around on social media to see if they're really true. Fact or fiction, you can use vodka instead of hand sanitizer to clean your hands, and you can drink vodka to kill the virus in your throat.
Oh, this is a good one. So this is definitely fiction, even though I'm sure a lot of people wish that it was fact. And let me explain to you why that is. So vodka contains 40% alcohol, and we all know from the CDC that in order to clean our hands and inactivate the virus, we need at least 60 to 70% alcohol. So it definitely won't work on your hands. And then in terms of drinking it to inactivate the virus in your throat, this virus mainly lives actually in our nasal passages. So that's not really going to work. And furthermore, drinking excess alcohol actually suppresses your immune system. So you're actually having the opposite effect and increasing your susceptibility to infection if you're drinking excess alcohol. So not a good idea. This is definitely a fiction.
All right. Plus, it can give you a hangover, I'm guessing. All right. Fact or fiction, right. Taking megadoses of vitamin C can protect against getting viral infection by boosting your immune system.
Oh, this is another good one, actually, and I'm glad that somebody brought it up because there's a lot of scams circulating out there about high-dose vitamin C and how it can, protect you from getting the infection. So let's talk a little bit about vitamin C. We do know that it's important in immune function. We also know that if you're deficient in vitamin C, such as with conditions like scurvy, which usually happens in the developing world, then you can have an increased susceptibility to pneumonia and other types of infections because it's involved in immune function. But there is no evidence at all that taking high doses of vitamin C boosts your immune function and protects you from infections. And in fact, in some people, it can actually be toxic. Now, there is clinical trials that are ongoing in China where they're giving intravenous vitamin C to people that are in advanced stages of the disease to see if that may affect the way their immune system is reacting to the virus, because that is part of the problem in this condition. But it's definitely not something that can help you prevent getting infected from the virus. So unless you're somebody who's at risk for vitamin deficiency, like you've had a bowel surgery, you've had gastric bypass surgery, or anything like that, this is probably not going to help protect you from the virus.
All right, good to know. I have one quick one here at the end. Fact or fiction that exercise boosts immune functions?
So this is definitely a fact. Exercise is really good for our physical health as well as our mental health. Plus it gets you outside the house, so it actually helps with vitamin D, which we also know is involved in immune function. But there is one important caveat, which is that exercise and immune function follow what's called a U-shaped distribution, which means that if you're too low on exercise, your risk of infection is higher. But if you're too high on your exercise, such as marathon running, you're running over 5 to 7 miles a day, those types of things, it actually triggers a stress response in your body, which can also compromise your immune function. So it's sort of like Goldilocks. You want to be just right with the exercise, which is usually about 30 minutes of moderate intensity exercise about 5 times a week.
Boy, that's pretty interesting stuff. All right, Dr. Kohli, thank you much. You're going to stick around to the next hour, and we have some viewer questions that we'll have you answer then. Thanks a lot.